This is Talking Point on StratNews Global. I'm Amitabh Revi. It's a pleasure to introduce from the capital, Srikant Sastri. He's a co-founder of CrayonData, the chairman of the IIM Calcutta Innovation Park, and the chairman of the I3G network. Thank you so much, Mr. Sastri, for joining us. It's an absolute pleasure to have you on StratNews Global for the first time.
Entirely my pleasure. Thank you for having us.
And from Kanpur, again, it's a pleasure to introduce Professor Amitabha Bandyopadhyay. He's the Department of Biological Sciences and Bioengineering professor, and also the professor in charge of innovation and incubation at IIT Kanpur. Both our panelists are the co-authors of the ventilator project, which we will be talking about in terms of lessons learned. Professor Bandyopadhyay, again, I do know you're extremely busy at this time, and really glad to have you on the show for a short while. If you could tell us what you're busy with, I do know that now something that's in dire need across the country, the oxygen is what you're also working on, right?
So you guessed it right. Yes, right now I am trying to work with, and of course, Srikant is again my co-conspirator in that. We are trying to work with multiple groups to scale up the production of oxygen concentrators in the country in a decentralized manner while the quality is in check. And it is, and we are also trying to cater to all different segments, 5 liter per minute volume, 10 liter per minute volume, really large 500 liter per minute volume, and all of those. Yes.
Srikant, if you want to elaborate on that, because we've seen and we are all experiencing, even personally, such horror stories about the lack of oxygen where it's absolutely needed.
Right. So absolutely. So the crisis, obviously, the second wave this year took everyone by surprise, and it seems to be much worse than last year. Although last year this whole pandemic was new to us. So everyone's scrambling this time for breathing, and oxygen is in short supply. People are flying in oxygen concentrators by the container load from China. Now I'll come back to why it's not a good idea to import from China in any case slightly later. But it breaks my heart to see us doing that with a country which a year ago we were at battle with. I think, but importing from anywhere is not a sustainable solution. We need things like this, which are so dear to our health, to be manufactured and designed locally. So that's what drives Amitabha and me to say we must support local innovators and manufacturers so that we're never again dependent on anyone else.
Professor Bandyopadhyay, if you want to tell us what exactly you're doing so that we can understand it in lay terms of how you're trying to get this done.
Yeah. So see, unlike the ventilator, oxygen concentrator is not really a rocket science. It's a pretty old standard technology. You need a molecular sieve called zeolite. There are different variants of it. They have different kinds of capacities and capabilities. What you do is you see 1/5 of the air roughly is oxygen, right? So if you pump in 10 liters of air and you can filter out nitrogen and some of the other gases, the 1/5, so 2 liters of oxygen should come out on the other side. But for this, what you need is to pump in the air at a very high velocity. For that, you need a compressor. Unfortunately, in the country, no one makes a compressor of that quality. So we are dependent on import. US companies we have tried because those are dependable machines. They don't have it, like they are giving us a lead time of 2 months. By that time, a lot of people will suffer. On the other hand, if we go with Chinese manufacturers, under normal circumstances, perhaps those products are all right, but they are massively ramping up their production. And our experience from the ventilator project is that under such situations, Chinese products may not be very dependable. So what we are trying to do is really this time, this is not an innovation game, it's a supply chain and manufacturing game. So what we are trying to do is we are trying to pull in a lot of manufacturers from different parts of the country try to generate some initial funding for them, and most importantly, create a centralized inventory and sourcing operation, so that when you are going to a vendor, if you ask, I need 100 compressors, they will not really take you seriously. You say, I need 100,000 compressors, they will take you much more seriously. Your lead time will be faster and your unit price will go down. So that is the objective, to create a centralized force for a decentralized manufacturing, at the same time having a centralized sourcing and distribution. So that is what we are trying to do. And in this, I am working with Principal Scientific Advisors Office. There has been a task force formed, and I am leading that task force. And on the other hand, I am also working with Srikant and our own incubator to do something in parallel.
Yeah, we saw pictures of that ventilator. I'll just come to that. Mr. Sastri, Srikant, again, just putting out a comment that's come from one of our viewers, Shai Desai, who says, excellent initiative, super proud. You mentioned also taking off from what Dr. Bandyopadhyay is saying on why China is unreliable, apart from what you were mentioning, the loggerheads that India and China were at. Are there any other issues that come up there? And the larger question of why we were not prepared for this?
Well, two different
Right.
questions. Why we were not prepared for this is a topic of a much bigger political debate that's playing out in news this year. So if I keep that aside for the moment, I would say that, look, to me, healthcare infrastructure creation, to me, is as important to our national security strategy as having the right airfields and defenses and the Battle of Ladakh. In both cases, we're losing the lives of our youngest and best and the boldest and bravest. So if we have to prevent that, we have to do it locally and can't depend on unreliable supplies from anywhere else, and especially not China, which is why what we're trying to do, actually, to add one more element to what Amitabha said, this time, because it's a simpler design, we actually want as many manufacturers as possible across the country from the SME segment. So you're really creating a manufacturing base across the country. 2 days ago, I got a call from someone, a senior official in the Bihar government, saying, can we manufacture this in Bihar? Now, can you imagine the ripple effect it will have in terms of local employment and local entrepreneurship? So that's the downstream effect that we want to create, apart from solving the short-term problem, actually.
The short-term problem, why? Sure, Dr. Bandyopadhyay, and why did we not manufacture these compressors that you were talking about?
Yeah, so that is the core issue. It is not just us. The entire world made the same mistake. They all outsourced the hard job of manufacturing to just one country, and we are all hostage to that country. I will tell you what I have actually seen, that we are asking for compressors, they're raising the price on an everyday basis. And not only that, when we are asking for compressors, they're saying, why bother buying compressors, buy oxygen concentrators from us. So because they control both the component and the finished product, they can arm twist us into buying the finished product from them instead of the components. Now, what we need to do from here on, and that's what I have been championing in every fora where I get a voice, is that we must strengthen our manufacturing base. And for that, we must, see, I'll tell you that I am also a laboratory researcher, right? I have a experimental lab. If I buy an Indian product, the tax on that is more than an imported product. Okay? So we need to look at the whole spectrum very, very carefully, how to encourage...
Why is that, Dr. Bandyopadhyay? Why is the tax on Indian products more?
Okay, so because Indian products come under GST, right? So for a science laboratory of an institute of national importance, you pay GST. There is no, now there is a discount, I should correct myself. But earlier, there was an import duty waiver, but there was no waiver for GST. So GST was still at 18% and import duty was at 5%. But now that has been corrected. But, the other critical component is that the quality. I have myself purchased Indian products out of my emotional feeling, and then I burnt my hand. The company from which I purchased it with a 5-year warranty, they refused to provide the warranty service after 1 year. The product broke down in a year. It was a knockoff. That is not how we should do it. What we should do is we should aim for excellent quality products, perhaps at comparable price with the imported products or maybe a little cheaper, but we have to change the mindset that lowest price is the ultimate common denominator. We must first go for the best quality, and the price can be the secondary objective.
Srikant, Mr. Sastri, that has been one of your core pillars, quality. I mean, even on all your projects, but especially the ventilator, which we were showing pictures of earlier, and even the two founders, we'll talk about robotics as well. Just very curious to if you could elaborate on what Dr. Bandyopadhyay is saying when he says that the companies, and I presume you're talking about Chinese companies here, who are insisting on one, either you buy their compressors or you buy their finished products, or they're literally, it seems, holding people hostage because of the situation. Is that, am I reading that correct?
Well, I would not go to that extreme, because the people who make compressors are different from the people who make concentrators. But all I would say is they are trying to make the most out of a crisis in India, and therefore both products are going up in price. But if I may take a minute to just answer your previous
Sure.
question, why were we unprepared? I'm going to keep away from the political debate on that angle. The issue is that historically we've had a poor healthcare infrastructure. And I'll give you two examples, and which one is, I was talking to this doctor in Cuttack. She told me that there are 100 nursing homes in Cuttack, only 7 of them had ICUs. That's the level of under-preparedness we have. Why is that the case? Because imported products are very, very expensive, and India today imports 80% of the medical equipment. Let me talk about this doctor in Yamunanagar. He told me that, you know what, just as Amitabha said, when I started my nursing home, I burnt my finger by buying a domestic product. I have a pediatric ICU. I can't afford to take chances. Therefore, I imported. So it's a chicken and egg story. Because you're importing 80% of the products, there's no incentive for local manufacturers to say, let me make it, because no one wants to buy it. The government is biased towards foreign products. Their procurement policies are such. Doctors are skeptics to buy domestic products because in their MBA courses, they're taught that these are the good products from across the world. So that cycle has to be broken somewhere. And we are hoping that what Noka Robotics is doing and more replicants like that will make a difference. And I think we are at a tipping point. This pandemic, this wave is the biggest opportunity for us to set this right once and for all, actually.
And you've shown that in your waiver. I just want to take another comment. If you want to look at this, Dr. Bandyopadhyay from K, who says, we are not ahead compared to China in advanced research like battery technology, advanced metals. Our industry is always working on legacy technology. We depend on small countries like Israel. How to change this? First of all, do you agree with that?
See, you have no option but to agree with that. Okay. The first step towards correcting the problem is to acknowledge that there is a problem. Okay. Now, these high technology products, they do not come from thin air. They come from years of fantastic high quality research, and the R&D ecosystem in the country needs to be strengthened significantly more. Like if you just compare the percentage of GDP expenditure on science and technology in our country versus other countries, the picture is absolutely clear. And I am sure if you go through the news reports, every government promised that they will increase the expenditure on science and technology, but it has not actually become reality. You look at any of the major corporations in the US today, you will always be able to tie it down to an academic R&D institution at one point or the other. So that is what is needed. What is needed is a calibrated increase in the expenditure on R&D, with a demand on accountability from us, the academics, that we just cannot take the money and say we are doing something fantastic, you will not understand. That we have to be held accountable, that here is the money, show me the product. Okay, I am not, see, I am a basic scientist myself. I am not saying that every scientist should do translational work or product oriented work. Without basic research, nothing will come out. Okay, but in an academic institution, maybe 5%, 10% should be product oriented people. And like we mix definitions, like institutions that have been created, as the name suggests, for industrial research, they claim that we are doing basic science. And the basic science researchers, they claim that we are doing product research. That's not how things work. You have to increase the investment and at the same time fix accountability. Then only things will happen.
Mr. Sastri, there is a huge amount of resistance just as an Indian people, but also systemically when you talk about either the bureaucracy or the medical fraternity in terms of looking at Indian solutions. There is one comment or question, if you'd like to look at it, from Harshal Gore, who says Indian bureaucrats should seriously consider how to make India self-reliant. Otherwise, we will be in even bigger trouble than the present crisis.
Harshal, since you ended your statement with Jai Hind, let me start by saying Jai Hind to you. To me, the government, since you referred to the bureaucracy, I'd like to say that in this whole saga, the government is both the hero and the villain, and I'll try and explain why. Since 2012, the government set up a dedicated autonomous unit called BIRAC, BIRAC, which was very, very far-sighted. They said the only way we can nurture domestic products in healthcare and life sciences is by supporting them. The government should support them. We have more than 500 such inventors that the government has supported. That was why I call the government a hero. But at the same time, I call the same government a villain because the government is the biggest buyer of medical equipment. And the government has failed to buy Indian products, because of which the great inventions have not been deployed in the marketplace. So it's a left hand not knowing what the right hand is doing. And this is an opportunity for us to say we have 500 great inventors and inventions. How do we provide them a market? The government is the biggest buyer. If we deploy those products, there's going to be demand. Once you have demand, local manufacturing happens. You're really going to create and make India a medical technology and health technology superpower. And you're no longer going to be dependent on Israel for technology or China for cheap imported products. So this is what needs to be done. So I don't think it's black or white. The government is both Dr. Jekyll and Mr. Hyde here.
So Amitabh, I want to give you another example, which I think you will find quite compelling. So you know that in the ventilator project, one of our guru mentors was Mr. Ajay Chaudhary, who is a Padma Bhushan. So Ajay is one of the co-founders of HCL Computers, right? I did not know till he shared an article with me that HCL came out with its first desktop PC in 1983, just a few months after Apple and 3 years before IBM. Now you may ask that if they were one of the first movers, why didn't they become an Apple or an IBM? The answer, there are many nuances, but one of the things you will be able to relate to very easily, in 1980s, computers were considered evil in our country. Nobody would touch it with a 10-foot pole. Therefore, HCL did not have any domestic business. On the other hand, Apple and IBM's, they had massive domestic business. When you have business, you earn revenue, you reinvest it, and your product gets better and better, while HCL lagged in that R&D and development. Same story is being repeated today because you are on the strategic side as well. Please do check that our drone industry. So because I am at IIT Kanpur, which has a fantastic aerospace department, we have 4 outstanding drone companies. The first drone company of the country was incubated at IIT Kanpur. All of these companies are today frustrated. Why? because the government rules and regulations does not even allow them, the new one, they are not even allowed to form a prototype without a license. To import a drone, which is a much bigger security threat, you need fewer licenses than to make and operate in India. So today, our drone manufacturers, drone innovators, they are not getting any business domestically. So clearly, they do not have the revenue. If they don't have the revenue, their technology will become outdated in no time. And then again, the same public and the politicians will say that what did our R&D people do? So this is absolutely bizarre, and we need to change this.
We need to change that. There's a comment from one of our regular viewers, Matara, who says the point is that Indians aren't patriotic enough. They are only hankering after Western labels. But Srikant, Mr. Sastri, again, we've been talking about the cons of the system. But I also want to talk about the positives which came out in what 20 plus of you did last year in 3 months when the ventilator came out. And those two founders, absolute geniuses from IIT, apart from you, to get that whole ecosystem together. Talk about that, Mr. Sastri.
So I'm going to pick up the cue from what Tara said there, that Indians aren't patriotic enough. If I now go back to the composition and constitution of that task force that we had for ventilators, 20 people came together, devoted 18 hours a day for 3 months only because they wanted to serve the nation's cause and save the country from the pandemic. That was the higher purpose. So that was patriotism for me. It was not just us 20 people. There were people across the country who helped us. At that point of time, the government went out of its way to help. And I'll give you just one example. First week of April last year, India was already under lockdown. Singapore was supposed to go under lockdown 2 days later. We had to fly in vital components from Singapore to make our first prototype in India. The DHL, other courier services, freight services said, no, we can't bring it in. The government, Singapore went under a lockdown. The government stepped in, Invest India, Ministry of External Affairs, and the Indian High Commission in Singapore. They found a Singapore Airlines flight coming to India empty to take back Singaporeans stranded in India. They took the components, put it in that plane, and even stood guarantee for the payment. And the government ensured that those components came into India. So when a crisis hits us, people certainly become patriotic and come together. But I think what is important for us is to transfer that patriotism to normal times also. Again, to add a final word on Tara's question, people want to be patriotic. But then you need to have products and services that are available domestically. Dr. Revi in Yamunanagar wants to buy Indian products, but he doesn't want to put small babies at risk. So if you give him a great product at an attractive price, he is all set to buy it. And that is why I would say Indians want to be patriotic. You just need to provide them the right conditions, and they will be patriotic at all points of time.
Just from your last point, Dr. Bandyopadhyay, when you're mentioning what's happening with drones, and especially the IIT Kanpur, there's a comment from Amitabha who says so frustrated and enraged to hear what you're saying. In terms of the positives that you take out of what happened in the ventilator project, Dr. Bandyopadhyay, getting minds together, the money, as you said, is there. And I also want to bring up another point, which a lot of Indians do look at, where they talk about brain drain. And this is the comment from Ashish Kumar. Brain drain is also a reason as to every bright student after doing a PhD moving to the US or other Western countries. We need to stop that. But then you have to provide the incentives to do that. Right, Dr. Bandyopadhyay?
Yes, absolutely. See, this Nikhil Kurele or Harshit Rathod, they could have very well had a fantastic career selling soap somewhere. Okay. But they wanted to be entrepreneur, and because of the government initiatives, we could provide them a home at the incubator of IIT Kanpur, give them funding. Can you imagine, like before they actually became a viable company, government funding to the tune of 80 lakh rupees was pumped into that company. So this is a big thing that nobody actually knows in detail, that our incubation innovation process have undergone a sea change since 2012. Now, if you are a good company, you can get very easily up to 1 crore rupee funding to develop your product. we will, if opportunity comes, I will tell you where the problem is, but this is something that has been done, positive thing. If you want the brains to stay in the country, people think that like a better salary stipend for PhD will do it. That is not going to do it. What will actually do is that, can you guarantee that if someone does his PhD in India, postdoctoral research in India, that person will be treated at par when we are considering for faculty positions? Or when will there be enough industries that will be willing and eager to hire these people at the price that they deserve? So that's what has to be looked into. Therefore, my take is that if we promote technology based industries as if there is no tomorrow, then everything else will fall in place, because those will be the attractions for the bright graduates to go to work for them. And the moment you create that job opportunities, then they will have no incentive to go abroad. And then automatically the demand will come onto the academic institutions that you prepare better and better quality engineers that can serve the ecosystem. So it is a very complex issue. We cannot view it with any one parameter or the other. It all starts with better investment in R&D, promotions of Indian, like product dependent technologies, and everything else will fall in place.
Amitabh, if I may chime in with just one comment to do with brain drain, if you don't mind.
Absolutely.
One is that there's been a sea change already. I graduated from IIT in the 80s. 80% of my batch went abroad because there's nothing they could do in India. Now that percentage is down to low double digits. So it's already changed because India has many more opportunities. I would also contest the fact that brain drain means a complete loss to India. No, it does not. One of the people who played a big role for our task force sitting out in the US is a gentleman called Yashdeep Kumar, who's a global R&D head for a big medical company in the US. He was mentoring our team. He continues to mentor entrepreneurs in India. So it doesn't matter where they are, patriotic Indians will continue to do what they need to do. And it's not a brain drain that's 100% therefore.
Right. I just want to, your last answer, Srikant Matara appreciates that. She says, thanks. I'm putting the wrong comment, but she does thank you there. I just wanted to, again, related to that is a comment from Shai Desai again, who says, how can India emerge as a healthcare Silicon Valley, or will we be limited to outsourcing, an outsourcing destination? We do know how that works there. I can see you both shaking your heads, so you have something to say. Dr. Bandyopadhyay, if you want to go first.
Yeah. So, things are already happening. All that is needed is the push. So, that IIT Kharagpur has already started a medical school within the campus. IIT Kanpur has already started the process of creating the same thing. In fact, I am heading the R&D task force for the same. So, nobody will doubt, the tertiary healthcare system in our country is absolutely top notch. Okay, it is comparable to any other part of the world. So what is missing? What is missing is that if you walk into a tertiary healthcare system, every equipment device that you see around you are imported. And what is missing is that we do not have in most of the states what is called the primary healthcare system and secondary healthcare system, because these two do not exist. Therefore, the entire crowd comes to the tertiary healthcare systems, particularly the government owned, and people say that nothing works. That is not the case. I have very good relations with multiple hospitals and doctors because I head the bioincubation activity and all of that. They are extremely capable and competent. It is just that they are overwhelmed with the crowd. They are treating diseases that are treatable and should be treated at the primary healthcare level. So what is needed? What is needed is that a very concentrated effort on making medical devices and the entire engineering. See, when you walk into a hospital, other than the nurses and the doctors, everything else is a product of engineering. So that's where we need to focus. And you take, like, I understand that there are issues taking doctors to the villages, so primary healthcare system does not work. But government of India in 1988 thought about starting telemedicine. I know that SGPGI Lucknow used to use a ISRO van taking it to the villages to deliver telemedicine. Today, with mobile phone 4G technology, tomorrow 5G technology is coming up, telemedicine should be the norm. We should just make very good quality sensors, very good quality point of care diagnostics, string it in with the telemedicine network so that villagers and people from tier 3, tier 2 town can be cared for at their location. And when you treat early, they will not even have a need to come to the tertiary care system. In parallel, you develop the engineering side of healthcare. I think within 7 to 8 years, you will see a completely different India when it comes to healthcare.
Amitabh, if I may provide a quick word on Silicon Valley, Shai Desi's comment. What is Silicon
Yeah,
Valley?
please.
It's a small 120 square kilometer area in California. What makes it so hot? There are great academicians, great researchers, great investors, and great entrepreneurs all put together in a cauldron. They interact with each other and create great companies. That was the competitive advantage they have. With COVID, that advantage has gone away because they are no longer meeting face to face. This is the time for India because what we showed in the ventilator project is that the same
Yep.
set of people can be brought together in the virtual world to perform that same magic, and Indian diaspora with great talent is available anywhere in the world. Location does not matter. Startup in Ranchi, startup in Guwahati, startup in Thiruvananthapuram can all access the best academicians, best researchers, best investors. This is India's time, and that's how you create a new version of Silicon Valley here.
So, Amitabh,
If you want to have the last word, I'm just taking Matara again, saying the talent in India is incredible. We need to tap it. But your experience, like it has come out in the book that you both co-authored, when you talk about Virendra Skina and the hockey junior team, then you go on to cricket. Now, startups and that talent is emerging not from, the main centers of cities. They're coming from the small towns, right?
yeah,
Absolutely.
yeah, because it is now possible, right? Because the location does no longer matter. And if we find talent, and like right now, we have incubated two companies from Gorakhpur, absolutely brilliant boys. They have not come from any of the pedigreed places, but they're just brilliant. So we evaluated them. Of course, we have a very stringent evaluation criteria. The moment we realize that they can deliver, we have brought them to IIT Kanpur. We have given them residence. We have given them access to all the infrastructure. You will see I promote them on my Twitter handle all the time. So this is now possible. So you do not have to be in the metro cities. You do not have to be from the IITs or NITs or the elite colleges. As long as you have the potential, you can deliver, you will have a very bright future in today's India. But I want to, if I have a minute, Amitabh, I want
Please go
to
ahead,
tackle
Dr. Bandyopadhyay.
Ashish talked about that we need to fight Western cartel. It is easy to blame the Western cartel, and perhaps they should be blamed. But we need to think about it. When it comes to medical care, Amitabh, imagine yourself that you are a doctor. The patient life depends on you, right? If you use a device and it fails, it is you who will be at the receiving end, right? So you have to have the assurance that the medical device you are using is going to serve the purpose. For that, what is needed is a very rigorous testing and certification regime. Can you imagine 70 years after independence in our country, there is not a single process? If I manufacture a medical device, our regulatory bodies, all it can do is that send a letter that this device does not require certification in India. Which doctor will trust that letter and use it? So the Western companies, they do have CE certification, FDA certification, they throw it on your face, then you have no option that you know that, okay, this is a dependable product. The counterpart Indian product is not dependable. So how difficult is it to create a very robust testing and certification regime in the country. We need to have that.
I'm just going to end on that note with two comments that have come in from our viewers. One, both appreciating our expert panel there. Thank you, StratNews and the panelists, for your clear analysis and answering our questions. Jai Hind, says Harshal Gaur. And if I can find the other one that I wanted to put up is, from Kiran K, who says, please give the notes from this meeting to respective government officials. I think that says it all. Dr. Bandyopadhyay and Srikant Sastri, I absolutely appreciate your time, especially though I know you are both involved in such important life-saving projects. Absolute pleasure having you both on StratNews Global.
Thank you. Thank you.
Thank you. Thank you for hearing us out. And I hope that, few people talk about it.
Dr. Bandyopadhyay and Mr. Sastri, absolute pleasure having you on. And for all our viewers, just a reminder, if you want to get notifications or notified for videos like this one that we put up, you just click on that bell icon on our YouTube channel and you will be notified for both live videos and videos that we premiere. To also follow our social media handles on Twitter, Facebook, and Instagram for the latest news and analysis from an Indian perspective. This is Talking Point on StratNews Global. I'm Amitabh.